the patient in control of his personal health data. That's also what we are striving for in the Netherlands. And we therefore have a MedMij, the MedMij Foundation. Our aim is to give people control, to give, well, again, like citizen-centered. So I've learned today health data, so that that will help, of course, the whole healthcare. We therefore developed a MedMij framework, and this is I've just watched Michael's what is interoperability network. Well, that's the same frame that we use actually in the Netherlands. MedMij is an initiative of the Netherlands Patients Federation, and we are financed by government and by healthcare insurance companies. And the situation here is that health data is currently scattered, and if it is available, if it's available at all, for patients, it is very difficult to understand, and that is due to that there is not one information standard. There are very many systems. There are like many languages that the systems talk. That makes the whole data scattered and diffuse. Still, our mission to help patients to get control on their health data. How do we do that? That is by introducing here personal health environment platforms like an app or a website. Also, as been seen before here this afternoon, we didn't come up with a PHE platform ourselves. That is up to the market, but we introduced this this framework. And this framework for data exchange that facilitates interoperability and integration, and information and models for data structure and exchange. I'll skip this one. This is how about it looks like. On the left-hand side, which is called here the care user, so say the patient, and on the right-hand side, excuse me. Sorry, something went wrong. Okay, and on the right-hand side, the care providers, so say the doctors or the GPs, and their systems. On the left-hand side, so there is the app, or and the thing is that in an app you would be able to collect all data from all of your doctors, whether it's a doctor or a GP or a dentist or a hospital or whatever. So you could collect all your your personal health data information in one app. That's the idea. There are different apps and there are different service providers on the left-hand side. We've left that up to the market. So different software companies produce different platforms. Now, the main thing is on the right-hand side that the information is so scattered, so diffuse. So in order to be able to exchange information, to exchange data, of course, you need to know that what you read is the same as what you're meant to understand. This makes it difficult. This is actually our main challenge. But we're doing that with help of the government. The government finances as well the MedMij framework in the middle here, as well as the left-hand side. So the companies that come up with solutions like the PHE platforms, and the government also pays on the right-hand side, pays software companies to standardize the information. So it's not really the orchestration. There is some orchestration, at least in the form of finance by the government. We would like to see a bit more actually, but maybe legislation will help us. Challenges that we face are, again, in the standardization of information, and the financing the whole thing. As I just mentioned, government finances, but that is only to start the whole thing, and government surely will not be paying forever to software companies to come up with updates, etc. So that is a thing. And third point is the quality of these platforms, of these websites and these apps, because we can't. Of course, they have to do tests, etc., to be able to join our framework. But well, we found out that is not enough, and so that's where we are now. Because we have that is the point where we are now, is that we are really the GPs that those are the first that really facilitated exchange to patients to those platforms. That is currently going on, and but we found out that it's not perfect yet. So well, maybe we can continue on that. So in the discussion later up. And the fourth challenge is how to scale up, and that is with the dilemma that we have, that on the one side, that was in the slide before, the right hand side, the information itself isn't 100% good enough, or at least you can understand it in different ways. And on the other side, the platforms, the applications aren't good enough. On both sides, it has to do with well, with finance again. And so actually, it's a bit difficult. Are we going to scale up now, and how quick are we going to do that, or would we like that to happen? Because when we would scale up too quickly, with the quality that's not good enough, that will diffuse patients and citizens surely. And that was what I would like to tell you about the situation in the Netherlands. Thank you.